GOLD participants from around the world. I'm Fiona Lang-Sharp, IBCLC Public Relations Manager and MC for GOLD Learning. Welcome to our GOLD Perinatal Online Conference. I'm sitting down today chatting with Nancy Irland. She's going to be presenting on demystifying gestational diabetes. Welcome, Nancy. It's great to have you here today.
Thank you. It's great to be here.
Well, you and I have been chatting offline a little bit, and I've had the privilege of seeing your part of your presentation already, not the full thing, but I was noting that it looks very dynamic. I want to tell our delegates that are listening in that they have that they're in for a real treat because it's a presentation that's got lots of animations and things. So I'm really excited to hear the full thing, Nancy, but I won't give away too much. But I do want you today, if you could share with our listening audience, could you tell them a little bit about yourself and perhaps a little bit about your professional journey?
Sure. It seems impossible, but I've been a registered nurse since the 1900s. I graduated at the age of 20 from a 2-year nursing program,
Beautiful.
and I've been working for 44 years as a nurse and always in obstetrics. And so in my 40s, for my midlife crisis, I went back and became a certified nurse midwife and I had a private practice for about 5 years. And then I wanted to sleep during the night, so I got a different position where I am a perinatal clinical specialist. And I review charts and do some teaching and mentoring to new labor nurses in a high-risk tertiary center.
Wow. So you're keeping busy and off the floor in the middle of the night, but you've got lots of charts to review now.
Yeah, I review the charts and give suggestions and advice on improving practice. It's a
Excellent.
lot
Well,
of fun.
that's wonderful. So you're probably a mentor, I can imagine, to many people who are out there. I I want to know more about your experience now, Nancy, about the gestational diabetes. Uh, when and why did you become interested in this topic?
It primarily started about 15, 20 years ago when I became a nurse midwife, and I had patients with gestational diabetes. And as a nursing student, I was very intimidated by the metabolic system and the endocrine system, and I just didn't understand it. So it was difficult for me to teach my patients about what was wrong. And I struggled with the educational information we had at the time. And to help myself understand it better, I had to tell it to myself in a story. So I
Mm.
made it into a metaphor for myself. And as I began sharing that with my patients, they would tell me that they understood it for the first time. So then I began lecturing to nurses, and I was sharing my metaphor with them as well. And they responded the same way, that for the first time they understood diabetes, and they were able to then take that back to their patients and feel more comfortable and more confident in how they presented the information.
Excellent. Well, I can see why. I mean, I've had a sneak peek, as I mentioned earlier, to our listening delegates here, but I truly am excited to hear about, all the concepts of how it came together and what it looks like and just have all of that information. Because I know for myself, working with clients that, you know, this sometimes really is, it's overwhelming sometimes, what
Yeah.
happens. And I think that's one of the things that I see for a lot of the clients is they're just overwhelmed with all the information and trying to navigate and figure out and talk to so many different people. So I'm looking forward to seeing all these strategies that you have. Lastly, before I let you go, Nancy, perhaps you could just tell us what you're most excited about sharing with our delegates without, of course, giving too much away.
Sure. Um, well, as I did this story and I was drawing diagrams to help explain it to myself, first of all,
Hmm.
um, I found some information that we don't share with our patients that put all the pieces into place. Because diabetes is often taught as though the cells are attached to the blood vessels. And I never understood really the connection between heart disease and high blood sugar until I found these secrets that we don't share with our patients generally. So I'm excited to share those
Oh,
secrets and how insulin can affect the blood sugar and how dangerous actually insulin can be. It's kind of a player that we don't mention much, and I think that it holds a lot of information that we need to know.
Excellent. Well, thank you very much. And thank you for sharing this time with me, being here today. It's been lovely having you.
Thank you. I think it's been a lot of fun.
That's great. Well, thanks everyone, and thank you to our listening audience who tuned in today. It's been Fiona Lang Sharp here with Nancy Ireland. Looking forward to having Nancy present on demystifying gestational diabetes. That's all for now. Thanks very much. Bye bye for now.